Right now, Queensland health system is under real pressure, and a big part of that is the rising burden of chronic disease. That's having an impact on all of us. The rates of chronic conditions like heart disease, diabetes and obesity are increasing, and what's worse is that children and young people are now starting to be diagnosed with the same. That was unheard of when I started out as a dietitian in the 1990s. More than half of all Queenslanders now live with at least one chronic condition. The cost to our patients is extraordinary, and the cost to our economy is in the billions. The good news? Much of this burden is preventable. In fact, more than a third of Queensland Health's burden could be prevented by addressing modifiable risk factors like poor nutrition, physical inactivity, smoking and alcohol use. Modifiable meaning they can be changed. We must do more to prevent chronic disease alongside treating established illness to support better health outcomes for Queenslanders and a more sustainable health system into the future. The wider determinants of health are the social, cultural, economic and environmental factors that influence an individual's health outcomes. To prevent chronic disease, we need to put these determinants of health at the heart of every level of prevention so that we can improve health, wellbeing and equity for all Queenslanders. We need population-level solutions that reach people early before the onset of chronic conditions. That's what primary prevention does. It keeps people well in the community and out of hospital. We need to target people who need it the most. We need to act early when problems do emerge with targeted approaches for timely identification and early intervention of chronic conditions. We know that secondary prevention lowers future healthcare demand, that's a fact, and we need to be proactive for those already living with chronic conditions. Tertiary prevention slows disease progression and reduces complications and healthcare utilisation. A new collaborative approach to preventive health is essential across all levels of prevention to protect our health and the health system. We were fortunate enough to have Dr. Lynn McKinlay share her expertise in health system leadership with our team, helping them shape this important work.
To inform the path forward, we engage with 267 key stakeholders across the state, listening to their insights, experiences and priorities. There was strong support for a unified framework to guide collective preventive health action, with insightful discussions shaping its key components. We also heard directly from 360 Queensland consumers. Their experiences reinforced the importance of prevention. 55% of consumers indicated they were living with at least one chronic condition, and 83% of those said they would have engaged with a preventive health service if it had been offered earlier in their healthcare journey. Queenslanders value prevention, and the opportunity for positive change is clear. Insights from this comprehensive consultation process have informed the development of a framework, strengthening prevention in integrated care systems. The framework provides a guiding approach for strengthening Queensland's preventive health ecosystem to optimise health outcomes and reduce the burden of chronic disease. At its core are 6 building blocks laying the right foundations for advancing chronic disease prevention together. Developed by Health and Wellbeing Queensland, the framework is designed to achieve collective leadership for health and community system leaders across national, state and local governments, not-for-profit, community, social enterprise and private sectors, making prevention everyone's business. You can access the framework on the Health and Wellbeing Queensland website. We invite you to apply the framework in your work and share your valuable insights. Your feedback will help shape its future evolution, ensuring it meets the needs of Queenslanders, the workforce, and the broader integrated care systems. Together we can strengthen prevention and empower all Queenslanders to live healthier lives.